Namaste, Dr. Divya here. So today we are going to learn about the cardiovascular disease which is known as the myocardial infarction. Today we are going to learn about this, what are the aspects of it and how to deal with it. And just remember that always for the benefits, do not run after the benefits but be aware about the contraindications first. So today we'll learn about the diet and the contraindications which is very necessary for the myocardial infarction. So let's begin the session. So a blocked coronary artery prevents blood from reaching your heart muscle and causes a heart attack. And what is a heart attack? A heart attack that is known as myocardial infarction is an extremely dangerous condition that happens because you don't have enough blood flow to have some of your heart muscles. This lack of blood flow can occur because of many different factors, but is usually related to the blockage in one or more of your heart arteries. Without blood flow, so the affected heart muscle will begin to die. If you don't get blood flow back quickly, a heart attack can cause the permanent heart damage and death also. So a heart attack is a life-threatening emergency. If you think you or someone you are is having a heart attack, so definitely call the emergency because it's a very serious condition, I must say. And the time is critical in treating a heart attack. A delay of a few minutes can result in the permanent heart damage or death. What exactly happens during the heart attack? So when a heart attack, the myocardial infarction happens, the blood flow to the part of your heart stops or it is far below normal, which causes the injury or death to the part of your heart muscle. When a part of your heart cannot pump because it's dying from the lack of blood flow, it can disrupt the pumping function of your heart. This can reduce or stop the blood flow to the rest of your body, which can be deadly if someone doesn't correct it quickly. So what are the signs and symptoms of it? What does a heart attack feel like? How it feels like? So many people feel pain in their chest during a heart attack, or also it can feel like discomfort, squeezing or heaviness, or it can feel like crushing the pain. It may start in your chest and spread or radiate through the other areas like your left arm or both the arms. This is a sign, you can say, a pure sign of the heart attack. Shoulder, neck, jaw, back, and down towards your waist. People often think that they are having indigestion or heartburn. Some people can think, but no, it's a heart attack sign. Some people only experience shortness of breath, nausea, or sweating as well. So what are the symptoms of heart attack? Heart attacks can have many symptoms, some of which are more common than others. Heart attack symptoms, some can say that people describe most often, which includes the symptoms of the chest pain, the angina they got. Another aspect of it, the shortness of breath or trouble breathing they are feeling. The trouble sleeping, you can say the insomnia, because people think, oh, it's a heartburn, it's something that occurs. I will not get the heart attack very easily, but they will get it. The nausea, the fourth, or stomach discomfort. And also the heart palpitations. Sometimes heart palpitations is increased also. Anxiety or feeling of impending the doom. Feeling light, headed, dizzy, and the passing out. People associated the male at birth are more likely to have different heart attack symptoms than people assigned female at birth. Okay, so people AFAB are less likely to have the chest pain or discomfort that feels like indigestion. They are more likely to have shortness of breath, fatigue, insomnia, and started before the heart attack, and that can cause the nausea and vomiting or the pain in the back, shoulder, neck, arms, or abdomen. So, what are the causes? We'll learn. The causes of the heart attack. Most heart attacks happen because the blockage is one of the blood vessels. You can say in the previous section we have learned the arteriosclerosis, in which the cholesterol, collects. So while collecting the cholesterol, one or the twice of the artery is blocked because of the plaque, a sticky substance that can build up on the insides of the arteries. And similar, it's low pouring the grease down, when in the kitchen you can find. So that is the greasy type of thing. It can resist in the arteries that builds up. It's called the arteriosclerosis. When there is a large amount of arteriosclerosis builds in the blood vessels to your heart, that is called as coronary artery disease, and sometimes the plaque deposits inside of the coronary artery. Coronary represents the heart artery and can break open and rupture and a blood clot and get stuck where the rupture happened. If the clot blocks the artery, definitely the heart muscle of the blood, it cannot pump and you can cause the heart attack. So this is a full physiology of heart attack, that first you will get the bad cholesterol, then bad cholesterol converts into the arteriosclerosis converts into the coronary artery disease, and then the coronary artery disease you can get the heart attack. So the coronary artery spasm also is a real medical condition. Like any disease that cause unusual narrowing the blood vessels, trauma that causes tears or rupture in your coronary arteries, obstruction can come from somewhere where else in your body, like blood clot or air bubble, like a embolism that ends up in a coronary artery. Eating disorders also, you can get it. Like over time, they can damage your heart. Like some people, okay, let's eat this, let's eat this, let's eat this also. This kind of, if you are eating a lot of cheese or sometimes a trans fat, you may get definitely the coronary artery diseases. The compression of these causes the heart attack. Other conditions also that can cause your heart to receive as much as blood at its shoulder prolonged period of time, such as when the blood pressure is too low, oxygen is too low for your heart rate is too fast. So what are the risk factors for the heart attack? Several key factors which affects the risk of having the heart attack. Unfortunately, some of these heart attack risk factors are not things you can modify. The age and the gender. Your risk of heart attack increases as you get older, because in the older stage you will find that more number of bad cholesterol is increased. Your gender also. Your heart attack starts to increase for people assigned male at birth. Male persons can get more heart attacks rather than female, because I think also the males cannot define their feelings. They are indulging the feelings only the inside. So that is one of the cause of the heart attacks for the male persons. So next is a family history. If you have a parent or sibling with a history of heart disease or heart attack, especially a younger age, you can have the greater, and your genetics are similar to theirs, your increase of the ability of the heart attacks, it will amplify. And also the lifestyle choices you make are not good for you. It can increase the heart attack. Some people with the hypertension also, they are eating lot of salts. Please do not eat. Those who have the heart condition, do not take the smoking, do not eat high fat foods, and also you are doing lack of physical activity. If you are drinking too much of alcohol, and drug abuse is also the condition. So some health conditions put stress on the heart and increase the heart attack risk. The diabetes, obesity, high blood pressure, high cholesterol, eating disorders, those who have the condition of just eat, and history of other problems as well. It can increase the problems of heart attack. So, what are the complications of heart attack? Complications includes the heart attack, include the arrhythmias, the abnormal heartbeat you will find. Heart failure, there are the complications. The heart valve problems, that the valve of the heart which are producing the sound of, you can say there is one sound which is coming in the heartbeat sound. Okay, so the flap of the valve is open and closed, but it is not opening and closing properly. So that is how you can create stroke, sudden cardiac arrest, depression, anxiety. Those who have the panic attacks also, sometimes they can get the heart attack because you cannot indulge the feelings inside of you in a proper way. So what are the diagnostic criteria you can get? If somebody can get the heart attack, you can first go fastly towards the healthcare provider, usually diagnose with the emergency. And also there are the heart symptoms, you should undergo for the physical examination. A provider will check your impulse, your blood oxygen levels, your blood pressure, and listen to your heart sounds and the lung sounds as well. They will also ask about the symptoms like dizziness if you have any kind of pain in the shoulder. I must say that is a sign of the heart attack. So that is how they can test it, and you can also test it by yourself, that okay, if I have these conditions, so I have to definitely go towards the healthcare provider. A healthcare provider will diagnose a heart attack using following tests like the blood test, electrocardiograms, they can test coronary angiogram, and the CT, the computed tomographies. So how can a person can get the lower the risk of these things? You can modify the things and you can prevent the heart attack problems. Must say that quitting smoking is also good, scheduling the checkups for the going towards the doctors. You should have a plenty of fruit diets, in vegetables like whole grains you can eat a good amount of food which indulge a lot of fibers, and those the things which reduce the bad cholesterol, particularly the LDL in your body. Okay, do not eat lot of sugars, lot of syrups, and quitting tobacco products, etc. I must say that for the yoga part, you cannot do any type of inversion postures. Like for example, people are doing very fast exercises, running, exercising, even prevent Surya Namaskar also. Just do the things which is very calm, like the relaxative practices, gentle stretching. You can go eating the nutritious foods, for example, the Mediterranean diets. The Mediterranean diets including the plenty of vegetables and fruits. Do not eat any kind of meats, non-veg or the saturated fats, because in yoga also we are not recommended. Because why? There is a reason behind it, that even in the Bhagavad Gita, if you will learn, there is a particular aspect that the tamasic food, there are sattvic, rajasic and tamasic. Sattvic food is for the yoga people, those who are practicing yoga. Rajasic, it comes for the middle people, those who are in the houses. The tamasic particularly, it will indulge lot of cholesterol, bad cholesterol. It will, give the ignorance to you, and you will feel more sleepy. So that is how you have to prevent this kind of foods. Although you can done yoga, deep breathing practices, meditation definitely, and also the gentle stretching. and prevent any type of inversion practices, headstands you should prevent. So this is all about that, the prevention. In the heart disease, you have to be aware about more in the prevention manner rather than to do it. If you have to do first, start with the breathing first. And even the Kapalbhati, Bhastrika, you should not do it. You can do Sheetkari, Sheetali Pranayam, Ujjayi Pranayam, which is very good. The Brahmari, humming bee sound, that affects amazingly with the process of deep relaxation, and that brings towards joy to your body as well. Thank you so much. I hope you have understood very well about the myocardial infarction or the heart attack problems, the signs, symptoms of it. Thank you for joining it.